Hi, Kristen. How are you? I'm Dr. Michelle. Thanks for coming in today.
Thank you. Nice to meet you.
And so what brought you in today to see an audiologist?
Well, I've been having a little bit of discomfort with my ear. I'm not sure if it's contributed to any hearing loss, but I've had a lot of ear infections just growing up, and I scuba dive and have issues equalizing, so I wasn't sure if there was something more going on.
Okay. Do you feel that sometimes you do have difficulty hearing?
I do think so.
Okay.
I mean, I didn't necessarily notice it, but my friends have noticed it.
Okay, so what have they said that, Kristen, you're not hearing us very well?
Yeah, they keep wondering why I'm asking what?
And that's very common. Do you ever feel sometimes that the hearing is better than others? That sometimes you think you hear well, and sometimes you're not so sure how you're hearing?
Yeah, like sometimes it's like foggy almost, like kind of like it's clogged.
Okay.
Clogged hearing, if that makes sense.
No, absolutely it does.
Yeah.
And you said you suffered ear infections as a child.
Yes.
The ear as a whole has three parts: the outer, the middle, and the inner ear, and all three parts have to work well in order to hear well. Ear infections, plugged ears, wax in the ear canal, all cause what's called a conductive hearing loss. That type of hearing loss, fortunately, can be remediated by an ear, nose, and throat physician. So for example, right now I hear you well. If I block my ear canal, it causes a hearing loss. I take my finger away and I hear better again. So conductive losses are often treatable by either medicine or surgery. When people have inner ear hearing losses, that's the area of the ear that cannot be remediated. And so when losses are in the inner ear, then the treatment is not necessarily with surgery or medicine, but the treatment would be with a hearing device. So what's really important is to determine, number one, do you have a hearing loss? Number two, is it the type of hearing loss that could be treatable or not? And number three, the severity. Okay, so what we're gonna do today is an assessment of your ears and hearing. First thing I'm gonna do is take a look in your ears. Perfect. So the next test that we're gonna do is called admittance. And what admittance does is measures the mobility of your middle ear system. When our middle ear system is normal, sound comes in, goes down the ear canal, and vibrates the eardrum freely, which allows the middle ear to conduct sound to the inner ear. If we have any middle ear problems, an infection, fluid, congestion, when sound comes in, the ability of that eardrum to move well is impeded. So what ends up happening is it breaks the conduction of sound into the inner ear. So since you've had a history of ear infections, let's go ahead and check that out. Doesn't hurt. Perfect. Typically, if the eardrum's not moving well, if the eardrum is stiff, it does cause a hearing loss. But we want to make sure that the loss is strictly conductive and doesn't have any inner ear component. So we'll move on to the hearing test. You're going to listen to a bunch of different sounds of different frequencies. Those sounds make up our language, so they're important to hear. And what you want to do is when you hear something, just give me a thumbs up in response that you hear it. Very good. The test is showing me that you have a mild hearing loss at all frequencies in both ears. When we listen with the headphone, the sound has to go through the entire system. So what I'm going to do now is determine if it's strictly conductive, being caused by the middle ear and that stiff eardrum, or if it's related to the inner ear as well. This device is called a bone conductor, and what it's going to do is present the same sounds, but it sits on the back of your ear on the mastoid bone, is going to only measure the response of your inner ear. So if this hearing loss is because of the middle ear being stiff, this will be normal, and that's what we want to see. And I'll start, and you may hear it on either side. That doesn't matter. Just let me know when you do. Perfect. So this test tells me that your inner ear is normal. With the headphones on, when sound has to go through your middle ear, the middle ear part is not working like it should. Therefore, it's causing you what we would call a mild conductive hearing loss. So the next step would be for you to go visit a local ENT doctor, and I can give you the name of someone who's local here in the Keys. And then after he assesses you and comes up with a treatment plan, I'd like you to come back to see me so we can check and see if the hearing's come back to normal. So after giving you the results and recommendations, Kristen, do you have any other questions?
I don't. I think you've explained everything perfectly.
Wonderful. So get that appointment with the ENT, and I look forward to you coming back in and seeing me. Thank you so much for coming in today.
Thank you.
Thank you.
I am so glad I met with Dr. Michelle today. I'm going to make my appointment with the ENT. It was quick and painless, and I didn't necessarily know I had anything going on, so I'm glad I can catch it sooner than later.